month since we've been here, and I'm very, very excited about today's topic. But before we do today's topic, you're wearing pink. Let's talk about that color that you're wearing.
Yes. So thank you for having me. I wanted to make sure I reminded all of our ladies that October is still Breast Cancer Awareness Month and that the goal is to remind all women to go and get their mammograms. They need an annual mammogram. So if you have
It's
not had one
awareness month.
for 2024, please schedule one as soon as you can, especially from the age of 40 on. If you're younger and you have any breast issues, feel a lump, feel pain, have some kind of changes in your breast, please go to your primary care provider and be evaluated so they can determine whether or not you need a mammogram. So once again, it is October, Breast Cancer Awareness Month. Please go and get your mammograms done.
So I know that we always talk about ladies and doing their mammograms and checking themselves out, but we very rarely talk about breast cancer for men. Can you just touch on that real quickly?
Sure. Um, yes. Obviously, men do have breast tissue. Most of the time, it's not in any kind of a growth area where they'll notice any lump. But if for some reason their breast tissue in their chest area, their pectoralis area is large, or they feel a lump or pain somewhere, that needs to be evaluated. Usually, they'll, probably do an ultrasound and order a mammogram. I've had at least probably 4 or 5 men in my practice with breast cancer. So it's definitely possibility, not obviously as prevalent in men as women, but men can get breast cancer. So men out there, if you do have a lump or some kind of a discomfort on one side or the other of your chest, your pectoralis area, please go and have that evaluated because you too may need a mammogram and a biopsy.
So when women do self-examination, what are they really looking for? And are lumps like when you think of a lump, I always think about potatoes or something that is really prominent. But how do they know what they're looking for if they're doing self-examination?
Well, it's different for every woman because there are some women that have lumpy, bumpy breasts. They have fibrocystic breasts, which means they need to get used to their lumps and bumps. And if they see any changes in that or feel any changes in that, that needs to be brought to someone's attention.
Okay.
I see you laughing. What's
Well,
up?
I'm laughing because you said some women have lumpy, bumpy breasts, and I'm like saying, "Wow, that's kind of rough." But that's just the tissue composite.
Yeah.
I think that it's so important that we are very conscious of our bodies and the examinations and understanding that um, if you do feel something, go and examine it. You might find out that you might have what they call a calcium buildup or.
They'll see a calcium buildup on a mammogram. Usually, what you'll feel is probably a cyst, whether it's a fibrous cyst or a cyst filled with fluid. So that's where, depending on the age, they will get an ultrasound to see if it has any fluid in it or if it's solid. And then if it's solid, they'll either consider doing a biopsy, depending on the age, or just go straight to mammogram to determine if there's any abnormalities there. So depending on the age and what they find will determine if they what's the next step. But you can get a fibrocystic breast finding that can either be filled with water and simple. If it's not bothering them, we leave it alone. But if it's painful or growing, we can actually put a simple needle in there and take out the fluid.
Okay.
But most of the time, they're fibrous tissues.
So if you have a cyst that has fluid, 9 times out of 10 that's non-cancerous.
Yes.
Okay, and if it's hard or a mass, then it could be either or.
Yeah, if it's firm and the ultrasound shows that it's not fluid filled, then they would want to consider getting a biopsy, a fine needle aspiration to put a needle in it, get some tissue, and then determine if it's fibrous or if it's got some malignant cells in it.
All right. Um, with this recently, and I know that we're going to talk about another subject, but just recently, Ananda Lewis. I don't know if you remember her from Teen Summit, MTV. She was a resident of San Diego, went to school here, the School of Creative and Performing Arts. She basically found herself in stage 4 breast cancer, and her best friend, one of her best friends, was also in stage 4 breast cancer. Her friend decided to do a full mastectomy, where she decided to go a holistic approach. Um, um, the advice on that is at stage 4, is it possible to go a holistic way and find your way through, or
I don't know of any successful cases where people go into remission from doing a holistic approach at stage 4, because stage 4 simply means that the breast cancer is no longer in the breast, it's in other areas of the body, not only in the lymph nodes, but maybe spread to the brain, to the bones. So at that stage, it's pretty aggressive.
yeah?
And I'm not sure if holistic is going to be the answer to cure them.
Okay. Well, the Susan G. Komen March is coming up. I believe it's going to be the weekend of November 15th. I'm very aware of that because we're doing a Stop the Hate campaign on the 15th, and one of my participants said he would love to be there, but he has been doing the breast cancer walk for over 16 years in support of his wife, who is a breast cancer survivor. When people go through breast cancer and they go through the medical portion and then they become into remission, are there groups out there or support groups that can help them, make the transition? And is it healthy to do restructuring?
So I'll answer the first question first. There are some support groups, but unfortunately, there's not enough support groups for women of color.
Okay.
Um, my good friend Wendy Sherrills does have a breast cancer support group that she has once a month. That's on Zoom, where there's women of color that's either going through, recently diagnosed with breast cancer, going through, or survivors that are there to help the newly diagnosed ones transition and understand the journey that they're going to be going through. But to be honest with you, the majority of black women that have been diagnosed or treated for breast cancer did not find support out in the community that they felt comfortable with. There are support groups, but the room is full of Caucasians and they just can't relate to that. So we don't have enough for our community.
Okay.
And the second part was what?
The second part was about reconstruction. Is that healthy once you have had a diagnosis?
So for the women that have had mastectomies, whether it's unilateral, one side, or bilateral, it really is a personal decision. You don't have to have reconstruction. That's definitely more surgeries and more time for healing. But if you do not feel complete, like a complete woman without having breasts there, then my suggestion is to go ahead and do the reconstruction if that's what you want. It's a personal decision. They do have to put some spacers in that has saline in it that helps to kind of stretch the muscle tissue and allow them to then put the implants in. So it's a long process, and they have bras that they make that have breasts in them that you still look fine in your clothes. But for some people, especially the younger ones, they may want reconstruction, or they may not want, if it's a one-sided mastectomy, they may want to feel whole by having reconstruction on that one breast, and I think that's fine.
And from a health perspective, it's still a safe process. It doesn't recall a reoccurrence of maybe cancer in that area.
No, it shouldn't. So, keep in mind that breast cancer can still come back as long as there's breast tissue, and sometimes it can come back in the muscle or the skin. But for the most part, when you're doing reconstruction, that does not put you at risk for having recurrence in that breast.
Have heard stories of women that come from families that historically have had breast cancer, and some have gone proactive and done full mastectomies, even if they're not testing with cancer. Is that going to be a common theme for a lot of people, or is that just a choice?
That's a personal choice. Think about it if you think about Angelina Jolie, whose mother had breast cancer, and she tested, and I believe she had the BRCA1 gene that was positive for mutation, that she ran the risk of having breast cancer. So without even being diagnosed, she just went ahead and had a bilateral mastectomy as a prevention. So there are some women that if they do find that there's a strong family history and then they do have the mutated gene, that they can choose to do that and be proactive than to wait wondering if I'm going to have breast cancer or not and then deal with it at that time. So it's always going to be a personal choice.
Wonderful. Well, Dr. Afflalo, thank you so much for giving us, that tidbit of information at the ending, close to the end of Breast Cancer Month. What next month? What month are we celebrating next month?
So for the health focus, You know, there's so many things for each month. There's a lot of
Yeah.
health issues, but you know, for our health fair, we tend to focus on certain issues. So it's going to be Diabetes Awareness Month.
Okay.
And I'll just plug in at this point, November 6th is our health fair at the Jackie Robinson YMCA. We have it every month on the first Wednesday. So diabetes is obviously going to be our focus. We always have blood sugar screening, and we have A1C for the diabetics that know hemoglobin A1C is when we measure their diabetes to see how well it's controlled over the last 90 days or 3 months. So we're always going to have that, but the focus for November is diabetes awareness.
Okay, and that's very good. And so I guess that will be our topic that went on that month to make sure. So all the questions that you have and might have even more, we definitely want to continue to look at that. But you know, Dr. Afflalo, there's going to be always so much we can talk about when they say ask Dr. Afflalo. So I'm just going to be real. We've had a great summer. You know, we live in America's finest city. You know, we have tropical weather, not too hot, not too cold, but the winter is coming. We're in fall season. They say the temperatures are going to drop. Lord Jesus, the rain is coming. The rain is coming. So now the question is vaccination. There are so many vaccinations out there, Dr. Afflalo. I got questions like, can you help us with what vaccinations we need to take? Because, you know, we done heard about the pH something for the kids. We done heard about the RH and the MO and the COVID and the flu shot and the shingle shot. And they got all these commercials on, and they petrifying us because they want to vaccinate us on every single thing. We got big pox, small pox, little pox. We got all that. We got horse pox. We got all this stuff. So, Dr. Afflalo, can you start us off with the basic things that we need in understanding these vaccinations and this combination of what we can take together and what's going to knock us out?
Okay. So that's so funny. But anyway, we are approaching or in the midst of approaching cold and flu season. This is viral season. When the weather gets colder, the viruses seems to start springing up. But the problem is that we also start going indoor and coming together in groups. So that's usually how things spread. The respiratory viruses spread by us sneezing and coughing and speaking close to each other, and those little droplets just get into the air and then get into our immune system, whether it's through our eyes, our nose, or our mouth. But the thing about it is I don't know if anyone remembers when we started with the COVID pandemic in early 2020. We were told to get in the house and stay in the house come March, whatever it was, 20th. When we were able to start coming out safely, we were advised to wear masks. I don't know if you realize it, but the flu numbers went down drastically during that time because we were not only not next to each other, but we were also, when we did go out, we covered our nose and mouth, which is where the viruses are usually expelled from. So we learned a valuable lesson that if you just cover your mouth and nose, that you really you decrease the risk of having these viral infections. So I would just say that we're now cold and flu season. We always recommend an annual flu vaccine. Most people have been getting it. We start at the age of 6 months, and we start giving it then, especially for our young and our seniors. For the ones that don't want to be down for a week with, you know, all the horrible symptoms of, you know, fever, body aches, cough, respiratory symptoms, nausea, vomiting, you name it, body aches, the whole shebang. If you don't want to be down, then you certainly can get a flu vaccine. And for most places, it's pretty easy to access it. You know, your Vons, your CVS, wherever, your doctor's office. But most people are okay with getting that vaccine and have been getting it every year and don't even raise an eyebrow to it. It's really since COVID pandemic that people are now like, oh, wait a minute, I'm not sure I want to get a vaccine. But for the COVID vaccines, and I'll just be transparent, I think I'm on my 9th one. So, you know, some people have not even had one. But for the recommendations, they are saying for the new vaccine that's come out, they call it the COVID-19 2024-2025 vaccine. I think they came out in September. And so we no longer give the one that was right before that. It's a new version that is covering some of the additional strains that are out there. And we're asking anyone 6 months or older to get this newer vaccine, COVID-19 vaccine, definitely for the higher risk patients, 65 and older, the ones that have chronic medical conditions, definitely the ones that are immunocompromised, and anyone that has not had a vaccine yet, because we have gone almost 4 years and there's still people that have not had one. If they're now willing to get one, we're recommending that they get it. So COVID-19, the newer updated version covering some of the latest variants, the flu vaccine, and then RSV. And that's really more for respiratory syncytial virus, really used to affect mostly just our babies and our seniors. But because we have so many more people that are at higher risk of getting respiratory problems and complications, we're recommending it to anyone over 65, but definitely people that have chronic medical conditions who are at higher risk of having complications, and anyone that lives in a nursing home and things like that. So you can get all three vaccines at the same time. I think I got flu and COVID at the same time. Not a problem.
Okay, so let me go back. When you say high risk, what does that look like? You know, because somebody say, "Oh, well, I'm good. I'm this." Are we talking about high risk as people with diabetes, people that have hypertension? What is high risk?
Yeah, high risk would, people that have chronic medical conditions would fall in that category, definitely diabetes. I would say anyone with a lung problem, so asthmatics, people with COPD, anyone that's a smoker that puts you at risk for having a respiratory complication, they would be a higher risk patient. And then anyone taking medications that decreases their immune system. So if they have something like rheumatoid arthritis and they're on steroids, they're not going to have the same response to something, and they're at higher risk for having complications. If they do just get a simple flu virus, it can really knock them out. So those patients know who they are. Their doctors tell them that, you know, you're going to need the flu vaccine and this every year because you're on medications. Transplant patients that are on a lot of immunosuppressant medications need to be protected from a simple virus that you and I can get rid of with just laying in bed and having supportive care. But for the other ones, it can be pretty much deadly for people that are at higher risk or have an immune system.
I'm sorry, excuse me. So here's my question. You go to the doctor. First thing they come in, would you like your flu shot? So you be like, yes, I'll take my flu shot. Then they come back, well, based on your age, you should have a pneumonia shot. And you be like, oh, okay. We just looked at your record, and we see that you haven't had an update COVID shot. You know, and then you look at them, and have you considered your shingles? So the fear is that you take all of these and you just get messed up. So tell us how we should do this, because, you know, I know because I have a doctor's appointment on Tuesday.
Mm-hmm.
And see, I'm proactive with my doctor. They were like, oh, when we come in, then we'll order labs. Like, no, order labs before I come. Y'all know the labs that we're going to do. We do it every quarter. Order my labs before I come in so we can talk about my labs in person. Mm-hmm. Don't send me no messages and everything. So, but I know that I'm going to get that. Well, you haven't had your flu shot, nor your pneumonia shot. And you know what you need to... So I'm trying to figure out when I go in on Tuesday, not saying that you tell me what to do, but I'm trying, you know, my schedule is really tight.
Mm-hmm.
I could be down for a good day, maybe a day and a half, but this whole week and being aching, you know, is for the birds. So talk to me. Give me some advice on
Right. I wouldn't get 3 or 4 at the same time.
Okay. Bless you. Bless you. I received that.
But I would say that if you are due for a pneumonia vaccine, that's important. But I would say the first 2 I would get, if you needed all 4 of them, I would go ahead and get the COVID and the flu vaccine first.
Okay.
And then the next week, go back. You don't need a doctor's visit. You just go into the nurse's clinic. It'll already be ordered and scheduled. Just go through there. It shouldn't take that long. Get you pneumonia vaccine and possibly shingles. Shingles can make your arm pretty sore, and it's a 2-part. So you do need to go back the month later and get the second part. So you just need to ask them all the different questions as to what. Shingles is definitely something you don't want to get, but so as soon as you can, you would get that. If you are due for a shingles vaccine, you need to get it.
Because, you know, I have to say this, and I know you're in the medical field and you're a doctor, but I'm about sick of these commercials because they're petrifying everybody. Shingles, and then they'll show, and they'll illuminate it and say this is what it looks like. My question is shingles this exasperated now, or has this always been around and we're just now advertising it?
Yeah, I mean, we're bombarded with advertisements. They need to stop that. 20, 30 years ago, we didn't have all of this stuff. And it is scaring people. But I would say shingles has been around for forever. It is the virus that lives in our body, one of the nerves. It's in the family of the chickenpox virus.
Mm-hmm.
And so if people have had chickenpox, it's very possible you have the virus in one of your, what we call a dermatome or a nerve ending. And at some point in your life, it can flare up. Usually under stress, it can flare up, and then you have a horrible experience with the pain, the numbness, the tingling, the burning sensation, intense pain along that nerve root. And it can be anywhere from in the head. I've had people that have had serious shingles infection coming up in their head, the neck head, and then close to their eye, bad rash. And the problem is if you get the infection, it's possible you can have post-herpetic neuralgia, because it's all in the herpes virus family, and that can last for a long time, and that's painful. I've had patients that couldn't even comb their hair, couldn't lay down on that side because that nerve is so raw. The most common place is along the back and the chest. And it's usually one side of your body. It's not usually both sides. It can be down an arm, it can be down the leg, but most common you'll see it on the commercials where it'll come from the back and come across around to the chest. It's not an experience you want to have. And I've seen it in even young as in their 20s, which I thought, well, wow, that's weird. Because most of the time it affects people older, in their 50s. That's why we vaccinate in the 50s, right, from 50 and above. But it can happen for younger people too. So, yeah, not a pretty thing to have.
And so that CBD ointment is not going to help the pain?
I'm not sure.
Okay.
There's not a whole lot it's a nerve pain, and it's pretty miserable.
Okay. So now, and I'm going to look at the age range of the 50s now, the 50 people. So what you're saying is first two, vaccination, and would be the COVID and the flu.
Yeah.
Then a week later, you're saying?
Yeah.
A week or two later. She said a week. I'm saying a week or two, but a week later, if you survive it, then you go back and get the flu and the shingles.
No, the pneumonia.
I mean,
pneumonia.
you just get the pneumonia.
No, you can get, if they allow you to get them both, yes, you can get them both.
Now, what about this RSV?
Well, RSV is not for everyone. Like I want, I'm in the age where they recommend it, but I didn't need it because I have no underlying medical conditions. And so I didn't need that one and haven't gotten it. That's probably the only vaccine I haven't received. But it's more for people at risk that have respiratory problems, elderly, maybe live in a nursing home, because it can be very debilitating, cause hospitalization or death for our seniors and our infants, the two extremes. So definitely 75 and above, they automatically vaccinate them. Between 65 and 75, they recommend it if you have any underlying medical condition that will put you at risk for more severe symptoms if you do get exposure to RSV.
Okay, so right now, the flu and the COVID, followed by the pneumonia if you need it, and the shingles.
Yeah.
And that's a 2-part series. Is it 3 months apart?
I think it's either 1 or 2 months apart.
Okay.
I can't remember that one.
So that's what we call a double tap.
Yeah.
You got to get tapped twice. Okay. So I'm just trying to get it all together. And then for some of them, they might need the shingles.
Yeah. So we start recommending shingles vaccine at 50 and above. You don't have to get it if you don't want to, but I promise you, if you don't want the possibility of having shingles. Pneumonia vaccine are normally recommended at 65 and above unless you're at higher risk, meaning you have some kind of pulmonary or lung problem. If you're an asthmatic, if you're diabetic, if you have COPD, if you're a smoker, they recommend it earlier than that. But for the average population, 65 and older. So if you're not there, that's not a vaccine you need. If you're not 50, shingles is not a vaccine that you need.
So I'm just going to ask a question. It might be a silly question, but I'm going to ask it anyway. This is asked Dr. Afflalo. If I got the flu shot, why I need the pneumonia shot?
Because it's two different infections.
Okay.
Yeah, flu is a viral infection, and usually there's several different types of flu strains. So the ones that we tend to make, and then they create the vaccine every year to kind of address the different strains that come out. So it's always to try to address and prevent severe infection from influenza A and B. And so H1N1, all those things. There's a lot of strains in that particular vaccine each year. Pneumonia tends to be a bacterial. I mean, you can have viral pneumonia, but we're not as concerned about that as the bacterial pneumonia. So when you're getting vaccinated, it's for the strains of the bacteria that can cause severe pulmonary problems and basically death if you're not careful.
Yeah. So let me ask you this question. When you might feel like, because people say, well, how do you know if you have pneumonia or not, or walking pneumonia? Some people say if you stand up straight and go and touch your toes, if you get pain in your back, it's like the fluid is moving in your lungs, and so you definitely need to go to the doctor right away. How do you know do you have pneumonia? Is there a self-test, or is it you just got to go in and get it checked out?
No, there's no self-testing. I've never heard of that. Bend over, touch your toes, and if you have back pain, I've never heard of that. But I don't know. I'm not sure who you're hanging around with and getting that information from. But
Dr. Afflalo, the saints of God of old, they got all kind of remedies. We grew up in the community, so we heard all kind of things.
Well, for pneumonia, it may present differently. Unfortunately, most respiratory infections kind of present the same way. You might get a little bit of fever, runny nose, sore throat, some cough, and you don't know if it's a virus or a bacteria at that point. But if you start having and you can have a dry cough, but if you have a productive cough where you're bringing up green sputum throughout the day and your fever's lingering, and when you're coughing, you're having pain along your chest or your back, those are definitely signs that you should at least go in and be evaluated and probably get a chest x-ray. I mean, you can still have chest pain and back pain just from excessive coughing, and you've now strained the muscles. But if you're having shortness of breath, wheezing, things like that you're not accustomed to because you picked up this viral infection that now can turn into a bacterial infection, you definitely need to be seen, evaluated, lungs listened to, chest x-ray done, and most likely sent home on an antibiotic.
So, Dr. Afflalo, can we do a color test? I know this is going to be bad, but I got to do a color test.
Okay.
So you said the green sputum.
Yes.
Okay. So my question is clear, white, yellow, green. When do we need to come in and see you?
I would say, because, most sputum in the morning is going to be discolored to some degree. It's been sitting in your chest all night. So the first production may be discolored. But if you're having, that's why I said green sputum all day long, or even a thick yellow sputum throughout the day, and you're having other symptoms with it, fever, shortness of breath, wheezing, that still needs to be evaluated. So you can have a dry cough and still have pneumonia. So it doesn't have to be productive. And some people don't know how to produce sputum anyway. It'll just stay in their lung. So, but yes, if you're having fever or a discolored sputum that's not just the first thing in the morning, and it's not just 1 or 2 days, that's something you might want to come and have us check out.
Now, Dr. Afflalo, again, the commercials are getting to me. HPV. They say all the children need to get an HPV when they become a teenager. First of all, could you help us out with that? And is this so true? Because they vaccinate on everything now.
Well, HPV is human papillomavirus. It's been around for forever. The commercials are just bringing it to the forefront right now. We have been vaccinating young 10, 11-year-olds for the last couple of decades. Mm-hmm. And the reason why is because our children are getting sexually active at an earlier age. Mm-hmm. And this is usually, the HPV is usually transmitted sexually, where someone picks up the virus and with sexual intercourse, they pass it on to their partner. So you can get genital warts from it, but you can also put the young lady at risk for cervical cancer, depending on the strains of HPV. So that's the reason why we recommend the Gardasil, the vaccination for HPV in the 10 and 11-year-olds. And I can't even remember now, it's a few vaccines, so that it can pretty much prevent the bad outcome of certain strains. There's a lot of strains of HPV, but there's certain ones that put you at risk for, Genital warts is one thing, but cervical cancer is what we're trying to prevent because our young women don't realize they have it and they're dying from it.
Okay, so definitely the young women, but for the young men, uh, do they need it as much as the young women?
Yeah, that's who we're getting it from. No, we're vaccinating young boys and girls because the girls are getting the HPV from the boys.
So if the boy who doesn't have it gets the vaccination, then they can't get it, or it's just not as bad.
I do believe that it's less likely that they'll get the strain that's going to cause the complications of the young girl that they may pass it on to, and that's the whole goal is trying to prevent transmission of this particular virus that can cause harm to the young ladies.
All right. So we talked about a lot of different vaccinations, a lot of different information, but I just wanted to ask, are there more vaccinations that we need to be concerned about that we don't talk about that we should talk about?
It depends on the age group because our children get lots of vaccines starting at 2, 4, 6 months, a year, and on and on. And then before they go to school, 5, 6 years, they get another slew of vaccinations. Obviously, the meningitis vaccines for our young adults getting ready to go into college, hepatitis A and B vaccines, because hepatitis B obviously can be sexually transmitted or IV drug abuse or things like that. And you can certainly have problems with hepatitis B, which can go into things like chronic liver disease and even liver cancer. So there are vaccines that are out there that are recommended, and it's up to the person to get full knowledge and decide if that's for them. But it's recommended for definitely hepatitis A, B, and I think those are the main ones besides the HPV vaccine.
Now, measles is popping up again, and is it mandatory still or not? Because I hear people saying that they don't want their child. It causes some form of dyslexia or some type of things that cause kids to not do as well in school. Are we still doing the measles vaccination?
Yeah, we are still doing MMRs, measles, mumps, rubella. And the reason why it's popping up is because we either having a lot of people coming over to the country that are not vaccinated, and then we ourselves are, now since COVID, people are not wanting to get vaccinated at all. So not only are they not getting what was recommended before for COVID, but now they just decide they're going to homeschool their kids and not vaccinate them because the schools do recommend a shot record that has the recommended vaccinations for kids getting into school. So people are just taking the alternative, or they're getting a doctor to write a note saying they should be exempt. So that puts the other people, if they're not going to have herd immunity of the majority of the kids having vaccinations to protect the other ones that aren't, you're going to start seeing measles popping up and other things.
Okay. Well, this is now I'm going to try to help the spouses. Dr. Afflalo, I got my vaccination, but I still wind up with the flu. Can you give us any quick fixes to get through that flu? Is there some elixirs? Is there some special tea? Because me as the strong man that I am, when I get sick, I go all the way back to elementary school, sometime kindergarten, because I'm just miserable.
Yeah.
So, when you get the flu, is it drink onion soup? Is it boil some lemons? Is there anything out there that can help it go quicker?
Yeah. So there is a treatment, there's an antiviral that we've used over years, 15, 20 years, Tamiflu, that if you are symptomatic and your symptoms are significant, and most people don't need anything, they just kind of ride it out. But truly, if you're at a risk population where you have underlying medical conditions the flu can tip you over and make the symptoms worse, my suggestion is Tamiflu is available. We'd like to catch it within the first 48 hours of you having symptoms, fever, body ache, headache, the whole shebang. It's more effective if you can get it in that first 48, 72 hours, and it does help to shorten the course, lessen the severity, and maybe not make you feel like a 6-year-old for the next 2 weeks.
Yeah, well, you said 48 hours. I done already reverted at 16. I'm already reverted. Now, what is this thing about garlic? Somebody said, some garlic could do it. Does garlic really help to build your immune system?
Garlic is good, but I'm not sure. I mean, it'll ward off the evil spirits, but I mean, garlic does have some medicinal purposes, but I'm not sure if that's going to help the flu.
Okay.
Yeah.
So let's talk about how can you effectively, what they say, build up your immune system?
Eating properly, eating the right fruits and veggies, and there's various things that can help. That, I mean, obviously, garlic is something that has some effective, potent types of things. But beets have things. All the fruits and veggies have that. What am I looking for? Vitamins and minerals in them that are necessary for our body. So if we just did a nice color scheme, all the purple things have antioxidants in them, your blueberries and your eggplants and things like that. If you just read up on the value of each one of those fruits and veggies, you would see that you could actually have a healthy immune system if you just ate properly and then minimize the amount of toxins that you put in the body that the body has to fight. So, not smoking, not drinking, basically not doing things that's going to harm your system. That would be helpful so your system has a chance to fight. Because most people, I mean, over the years, if we've eaten properly and not had the processed foods, back in the day when we grew our own stuff and we had our own animals we could slaughter and eat, it was healthy, it wasn't processed. But now everything is a quick fix. We've turned into a society that we want something yesterday, and then it's packaged in something and we nuke it in the microwave, and then you wonder why you're getting all the different cancers and things. So if we can go back to as basic as we can, I realize we need convenience because we're all on a very, very busy schedule, 2-3 jobs and that sort of thing. But if you can keep some natural things that are grown, fruits and veggies that are not processed, and you can handle that, that will help your immune system. And you're welcome to do a multivitamin and stuff like that. That does not hurt.
Well, Dr. Afflalo, being that you're evergreen and you always look like you just left high school and all of that good stuff, if we were to go into the kitchen, I'm calling it the laboratory of the food, and we were going to pick 6 vegetables to ninja to make our morning drink, what would be the top 6 vegetables? Not that you would recommend, not that it's everybody, but what you would recommend to give energy and put some of the right nutrients in our body. Because see now, me personally, if I got in there and I had to pick 7, apple would be 1. I'll probably grab a banana for the potassium. Then I would get a whole bunch of kale because then that'll turn everything green. You know what I'm saying? Then I'll get real creative. I'll throw some almonds in it, And then for sweetening, I'll throw a date, not a whole date, just a little bit. So I had a little surprise chunks of date, like little candies in it, and some water, and some cucumbers with a squeeze of lemon.
Yeah, that's a good start.
Okay.
Yeah, I mean, anything you can go with a fruit, so an apple, a banana, some pineapple. You can certainly, cucumbers are refreshing, it's full of water. Definitely anything in the green family. So I like spinach and kale, things like that. You can put in there to give you some of those vitamins and minerals. Blueberries are good too. And then if you want a healthy fat, you can put a scoop, a spoon of almond butter or peanut butter or something, or a date. But you don't have to do any of that. So, but you have to be careful. A lot of people like to go to smoothies, but then there's nothing but fruit. And that's a lot of sugar. So we don't mind you putting fruit in, but it shouldn't be 4 things of fruit. It should be 1 small serving of fruit to flavor it. And it does have fiber, so your apple has fiber too. But then a lot of it needs to be, the green leafies and things like that. And the almonds are fine. That's a healthy nut or healthy protein.
So what I'm hearing you say, if I do a base of kale, followed by some cucumber, followed by, let's just say 1 fruit, an apple. I got to get rid of the banana. Can I use is almond milk okay? Can I throw almond milk on it, or should I just use straight water?
I would use water.
Okay. Is there a certain type of water I should use?
Not really. I mean, I don't believe in all the
The
alkaline
spring,
water and
okay.
Suds of Spring and all that. Yeah, just whatever you're accustomed to.
Okay, but I can throw a date in there for a little sweetness.
Yeah.
Now, tell me about this agave.
Um, it's a natural sugar
Mhm.
that's obviously processed to come out of the plant into a thing. I mean, it's better than a refined white sugar or even a raw brown sugar.
Okay.
But, you know, as much as you can, it's probably better to sweeten it with a fruit
Okay.
than some of these other things if you can avoid it. Honey, you know,
Mhm.
is also an option too.
Ooh, you starting something. I got a question about honey.
Oh, I might not have all the answers to them, but I mean, that also is another option for sweetening, just not in excess.
So let me ask you this question, and these are all things that we hear in the community. But I heard that when you have bad allergies that to pollen, that you should take raw honey from the region that you're in, from the bees that were produced in your region, and it actually helps you to build your immune system up against the pollen that causes you to get your allergies. I'm just
I've never heard of that. I'm sorry.
okay.
I'm not in touch with your network. I
Okay,
haven't heard of that. So,
well, in the community, you hear all kind of things, and so and real true, or I imagine, I think that it's important for us to talk about it because sometimes people are doing things consistently, thinking that it's actually helping, but it could be making their situation worse, not knowing that this was something that Mama did and Grandma did, but we never knew why. You know how they say you get a sock, throw some garlic in it, and put this and wrap it around your neck, and you'll be better the next day.
well, you know what? And when you were asking about I guess your smoothies or your healthy drink, I mean, you can also put things in there that are also good for the body, like ginger and turmeric and things like that are anti-inflammatory. So there are other things you can add to your beverage if you choose to drink that meal that day. So and carrots and beets are all good, you know. So it really depends on what you like, and you can always change it up.
Well, I gotta ask this question. Turmeric. They said it helps with the inflammation, right? How much turmeric do you need to put in, and how much cinnamon? Because they say turmeric and cinnamon. They say cinnamon help your blood pressure. They got all these different things. But how much turmeric do you need to really put in to actually have an effect on your body?
Well, I think it needs to be consistent.
Okay.
So you can either boil the turmeric or you can, peel it and put it in a small amount in the beverage that you're blending
So
up.
that powdered turmeric ain't what we
You can use that
Okay.
too, like a
Okay.
teaspoon of that. And sometimes they say put pepper on it to make it more effective.
Now, is that
that's
cayenne pepper or black pepper?
probably black pepper, but cayenne pepper too. The problem is that how it's not going to be as easily palatable.
Uh-huh.
Sometimes that stuff is really strong.
Uh-huh.
So, and they want you to take a shot of that or something. I mean, it will be helpful, but can you tolerate and can you sustain it?
Okay. Now, here's another thing: apple cider vinegar. Talk to me about that, because everybody taking shots of apple cider vinegar. They say it's helping them digest better and all the other things. I'm just trying to, as we're talking about, vaccinations and the flu season coming up. When that comes up, people come up with concoctions, and so I want to help dispel some of the stuff that we've been hearing one way or another.
Well, to be honest with you, I've never used apple cider vinegar. I do have some people that I know that's used it and it helps with digestion, but I personally have not done the research on that, so I can't be a testimony to it.
Hey.
I would just say that if it works and is not causing any harm to the things that they're already taking, like medications, that it shouldn't be a problem, but everything in moderation.
Now, my question with all the things, how does constipation cause illness in our body?
Well, just think about the backup of all the toxins that are not being processed and coming out of your system. Constipation can be pretty horrible, but it's letting you know that your bowels are sluggish, so it's not moving things through fast enough. It's a motility problem too. So if you're eating a lot of foods that are constipating, like cheese and bread and stuff like that, and you don't have enough roughage or fiber in your diet, then you can find yourself getting backed up. And then if you have a motility problem with your bowels that are moving things through quickly, then you can have diarrhea. So there's always a chance to add more roughage to your diet easily with the green leafies, but you can also add some fiber like Metamucil or Benefiber, or to stir in some water or something. And I just want to say, in regards to that, water is your best bet for anything. So 99.9% of the time I drink water. So you're talking about how I look young, my skin feels whatever, but I've only drank water 90%, 99% of the time. I think that's really helpful in terms of flushing things out. So as much as you can avoid all the processed beverages that are full of sugar and other things, that would be helpful to your system too. And water does help with constipation.
Now, Dr. Afflalo, you done said another thing again. I'm watching TV, and you said sluggish bowels. When did we start having sluggish bowels, Doctor? I've heard constipation and everything, and I saw the big benefiber and all these different things. But now sluggish bowels is a symptom or is a disease or something. The way they have it on TV.
Well, I'm not sure what you saw, but there is a lot of bowel issue. And I know women more than men suffer from irritable bowel syndrome, so called IBS. And sometimes you'll have constipation, sometimes you'll have diarrhea. So they'll have IBS-C, which is IBS with constipation, where their bowels aren't moving regularly, and they're sluggish, right? So the motility of the bowels, because it's a muscle. Your bowel is a muscle that's moving things through. But if it's not moving it through in a proper amount of time, then you find yourself getting backed up. And you can actually have bowel obstruction, where we literally, and I don't want to get into it, have to go in and decompact you because nothing's coming through, and you can start actually having vomiting and things like that. So it's a normal process that has to take place, and if it doesn't, you can run into problem. So the irritable bowel syndrome is more common in women, tends to start in the ages in their 20s because that's when stress from college and other things start happening, and they find themselves actually getting flare-ups when they're stressed. So and most of them don't want to go out and eat because the minute you eat something, you have to run to the bathroom in like 15 minutes. It just kind of runs through you. So in those situations, you've got to get control of the stress that you're dealing with and a diet that's more balanced in fruits and veggies, and then maybe actually even having some fiber added to kind of balance out the constipation and the diarrhea. But it's really handling the stress.
Okay. So would we say that since we're going into cold and flu season, we are getting vaccination? One of the best defense to help us go through any of it is that we have to decompress and de-stress.
Yes.
Okay. So we just got to get through these elections, because
Yes.
that is causing stress for so many different people. I want to ask these questions because these are just things, chamomile tea, does it really calm you, or is it just a myth that they just want you to just think that if you drink chamomile tea, you're going to be calmer? Me personally, I like ginger tea. I like the kick. But are there certain teas that help us to relax more? Is it really true, or is it just mental?
That's a good question. I'm not sure. It could be mostly mental, but chamomile and lavender and things like that, peppermint, those things do have a soothing component to it. Just like if you put peppermint oil or lavender oil in the area, it can be relaxing. But it's for people going through certain types of stress, it's going to take more than that.
Okay.
But, we do recommend chamomile tea and things like that at bedtime to kind of relax you so you can go to sleep. But for some folks, they're way past the tea stage. They need some, I would say some techniques, meditation, relaxation types of things. I'll say music and things, jazz that might relax them, whatever it takes to get them from, off the ledge down so that they can deal with life. But I would just say I'm not sure if chamomile is just all mental, but there are some soothing things to certain types of, like lavender is one of my favorites.
CeCe Winans, gospel great singer, was interviewed by GOD Radio, and the question came to her is, how do you stay so young and how do you stay so vibrant? And she said, I literally worry about nothing. Everything is in God's hands. So the stress that we're talking about getting rid of is that we have to put it all in God's hands and literally worry about nothing, because no matter what happens, He's got it under control. That's number one, that could help de-stress you. Number two is eating right, because some foods do put your body in distress. I still don't know why, Dr. Afflalo, maybe you can allude to this. why anybody would eat the death chip.
The who?
The death chip, the chip that's so hot
Oh.
that they coughing and everything else of that nature. Can you just let people? Do you know what? Can you explain what happens to the body when you eat something that hot? Because it literally looks like they're going into cardiac arrest for some of these people. Some people start coughing. Some people start screaming. Some people can't breathe. And some of these chips have put them in the hospital.
Why do we make that stuff?
That's
Obviously,
shouldn't it be
obviously,
illegal?
there's a clientele that wants it, and they whatever their fix is. I find it more with young kids. I didn't realize adults, older people eat that stuff too.
Anything for a YouTube feed.
Oh Jesus!
And they doing challenges. And I literally saw the saints of God, some church brothers and sisters. They was a whole group of them, and they all had the chip. And literally, I started praying for them because I already knew what was going to happen because, some people say they can eat hot stuff, and I'm doing this as a thing about, how we abuse our body, and where we're getting ready for cold and flu season, that we got to make sure that we're going to take care of our body, not put our body in stress. But I was in the barbershop, the Black Man's Country Club, and everybody was bragging about they can eat hot food, And so, I had the experience with my lovely wife up in San Francisco. We went to a salsa factory, and she was trying to find salsa for her mom, because mom loves salsa and everything. And they said, well, here's a hot sauce. It's called Dave's Insanity. It's supposed to be the hottest sauce in the world at this time. And I remember Dave's Insanity on Brian Gumbo, who always talked about he can handle hot food and everything like that. And he said, oh yeah, it has good flavor. But as he kept talking, it kept getting hotter and hotter to the point he started coughing, his eyes started watering, and then he said, oh, I ain't gonna do that again, but that's hot, but it got good flavor. So my wife, when they told her about it, they said, we're not gonna let you, put it on a chip. We're gonna take a toothpick. We're just gonna give you a little bit on the toothpick. And so my wife put it in her mouth, and she said, oh. And, she did the double smack. When she did the second, that heat, and all of a sudden her body went into distress. And she's running around trying to find something. Nothing would help. So that was then. So I had brought the Dave's Insanity back to the barbershop, and I said, now who really wants to prove that they can do hot? So, I brought chips and everything.
Oh no.
And I gave the one that did the most talking, I gave him a full thumbnail. Everybody else I gave a pinky.
Yeah.
And when I tell you that two of the barbers went home, they couldn't even cut hair no more. The only person that could handle it was the female barber. And she said, oh, it was hot, but yeah, it had good flavor. And she just worked like, she just had, just regular salsa. When we put our body through that type of trauma, how does those stressors, and what does our body do to really combat when our body goes into that type of trauma? And does our body throw toxins into our system because we're so stressed or so traumatized?
Well, I'm not sure if it throws toxins or some of the neurotransmitters and things that make you want to kind of a fight and flight type of thing. But I just don't know why we can't learn from the first time that if we do something like that and it's not conducive, if our body's coughing and hacking and burning and, we turn a color and our eyes are watering, that we decide to do that again because our body's not happy. So, and you will get, if it's that hot, you're gonna start burning in the GI tract. So it can certainly irritate the lining of your stomach and your intestines and things like that. I don't know why people do that, just for the thrill of it, but I'm sure the body's not happy.
Yeah.
And over time, you'll probably have some consequences.
Yes, and I agree with you 100%. I'm going to put in my bid early on with Dr. Afflalo. Play Day at the Lake is going to be June 7th. This year it's going to be on Saturday. And we would love for Dr. Afflalo and her mobile to be out there at Choyas Lake, because we're going to be doing something big out there. I just want to put that on your calendar because it just came to my head. But that's my prelude to, can you talk about the upcoming uh, uh,
The health, the
the
health
health
fair?
fair, the upcoming health fair, and just give us a recap on our vaccinations.
Okay, so the upcoming health fair, we do have a community health fair, health and resource fair, the first Wednesday of every month from February to December. We go dark in January because it's too close to the new year. Um, it is the first Wednesday. It's from 10 to 3. It's at the Jackie Robinson YMCA in their parking lot. We have a lot of health screening, um, diabetes screening, blood pressure, cholesterol screening. We have a lot of providers there, nurse practitioners and physicians and medical students and residents that can speak to the health issues that any participant has. We have nurses that are doing blood pressure and all this actual screening. There's a lot of vendors out there with different resources to meet the needs of the community. A DJ that does music for us. We do have breast exams on site. We're looking next year to bring the mammogram van back out. We just have doing some logistical stuff to get it back out successfully. And then we've got, and then we have vaccines that we provide there. So we will have the flu vaccine. We should have COVID vaccine. There's two types of COVID, meaning it's not two types of COVID vaccine, but there's a set of COVID vaccines that we can provide to people that have insurance. And then through the county, for the ones that are uninsured, I'm hoping that we have the ones for the uninsured that are available. But we will have COVID vaccines and flu vaccines there. Obviously, the Kaiser mobile van is there for anyone, but for Kaiser members, we do appointments on that van. And then the Humane Society comes out there for anyone that has pets. They serve their cats and dogs and rabbits and whatever you bring, they'll do exams and vaccinations and microchipping for them. So we're just trying to take care of all the needs as a one-stop shop. And the most important thing is people come there for the free produce. So we're now partnering with Feeding San Diego and San Diego Food Bank. So we have twice the amount of produce and a few packaged things, but that's really the highlight, is being able to provide a need where there's still, people are not able to afford groceries. So that's part of it.
Well, I just want to ask you the question, Dr. Follow. Somebody said that y'all got line dancing out there too.
Yeah, we do. When I don't get to do it sometimes because I'm in the mobile van doing seeing a patient. But yes, Wendy usually is doing line dancing out there. She'll get myself and one of the other doctors to be competing and stuff like that. But it's a fun event. It's outdoors and it's non-threatening, and people just come and enjoy themselves. So, come check us out.
And this has been going on for how many years?
8 years.
8 years. Again, started with a vision and a need.
Yes.
And a need, and the vision met the need. And it is something that you all do by faith every time, and we want to applaud you for that. So every first Wednesday at the Jackie Robinson YMCA, it starts at what time?
10 a.m.
10 a.m. and goes to 3?
3.
It goes to 3. So it's a one-stop shop. Now, I'm going to tell you that if you see me out there, please, if you have a pet or a dog, I have allergies. Don't you come up and say, "Oh, just look at Fido and Hope." No, unless it's a fish, and it's not a piranha, then I'll be like, "Ooh, bloop, 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 bloop." But everything else, y'all just go on and have fun and get the vets to check them out. Dr. Follow, if you could just give us a recap of the vaccinations you're recommending people talk to their physicians and what they should be concerned about.
Sure. So the cold and flu season, we do suggest that you get the flu vaccine and the COVID vaccine because COVID's still around with a few different strains. It's not as deadly as it was in 2020 and 2021, but it's important that there's still people that are at risk for getting very sick, being hospitalized and dying from COVID and even flu. And then definitely RSV if you're at higher risk and definitely older. The young kids and the seniors need the RSV. And then, of course, you mentioned shingles, which at the age of 50 and above we recommend, and pneumonia vaccine, the age of 65 and above, unless you have lung conditions, asthma, lung problems like COPD, or a smoker.
Now I'm going to ask this last question. If you're married, do you recommend husband and wife get the shots together? Or should one not get the shot and take care of the other one? Or should they just be in it all together?
No, go and get the shots together.
Okay. Well, there you have it, ladies and gentlemen. It has been an hour packed of great information with Ask Dr. Afflalo. God say the same. We'll be back here next fourth Thursday right here on Stellar Award-winning station, GOD Radio 1. Y'all be blessed.